New tonight, the CALL7 Investigators breaking news in the Aurora Theater shooting case. When the CU psychiatrist treating suspect James Holmes called campus police, sources tell us there was a discussion about putting Holmes on a mental health hold. CALL7 Investigator John Ferrugia breaking new information. And John, you've learned the psychiatrist declined to ask for that hold.
That's right, Mike. And what is also new information is that Dr. Lynne Fenton made calls not only to campus police, but to other members of the university's threat assessment or beta team the day after Holmes submitted paperwork to drop out of school and the day before his campus pass was revoked. It was 6 weeks before 12 people were killed in the Aurora Theater when sources say accused murderer James Holmes told his psychiatrist, Dr. Lynne Fenton, something so disturbing that she called members of the CU threat assessment team and campus police, telling them Holmes could be a threat to others. Sources familiar with the investigation now tell me that Fenton made those calls the day after Holmes submitted paperwork to drop out of the university. This is significant because, as we have reported, on June 7th, Holmes failed an oral exam necessary for him to continue in CU's neuroscience PhD program, and he did not have a required mentor. In the afternoon on that same day, Holmes purchased an AR-15 assault rifle at this store in Thornton. Holmes had already purchased a .40 caliber Glock handgun at Gander Mountain and a 12-gauge shotgun at Bass Pro Shop. On June 10th, Holmes submitted paperwork to withdraw from the university. And on June 12th, his security card was canceled by the university and he could no longer access secure areas or labs. But sources say it was the day before, on June 11th, that Dr. Lynne Fenton made the calls concerned that Holmes could be a threat. Multiple sources say that when Fenton called the campus police asking for and receiving a background check on Holmes, there was a discussion of whether to detain Holmes on a mental health hold. Multiple sources familiar with the investigation say the CU officer had no independent information or warrants that would have allowed the campus police to pick up Holmes. But sources say the officer deferred to Dr. Fenton, asking whether she wanted to order what is known as an M1 hold on Holmes, which would have given psychiatrists up to 72 hours to assess his mental state. Multiple sources say Dr. Fenton declined the hold. As we have previously reported, several sources confirm that because Holmes had left campus on June 10th, the threat assessment team never convened and local police were never called. Now, mental health and threat assessment professionals we have spoken with say that when Holmes dropped out of school, it should have been a serious red flag, especially when coupled with concern about his threat to others. Now, the university has retained lawyers not only for Dr. Lynne Fenton, but several members of the threat assessment team and members of the mental health team at the CU Anschutz campus, including other psychiatrists. Now, we contacted one of Fenton's lawyers tonight. He cited a court gag order saying he could not comment. In the newsroom, I'm John Ferrugia, 7 News.
James Holmes is scheduled to be back in court this Thursday. Stay with 7 News and the CALL7 Investigators as we continue to break new details in the shooting investigation. And you can read John's reports from the very beginning of this story right now on thedenverchannel.com.